Hi there, I'm Dr. Phil. Welcome to embarrassingproblems.com. Today we're going to be talking about asking questions. It sounds a relatively simple thing to do, but people get really embarrassed when they're in front of a doctor. They don't like to ask questions, they don't like to appear ignorant, they don't want to waste the doctor's time, very busy person. And so often you'll go in and out of a consultation without really getting much of a handle on what you've let yourself in for. You don't know what the diagnosis is, can't really remember what the treatment is, you haven't written anything out. You're feeling just a bit bewildered and confused and your 6 minutes has gone in a flash. So what should you do? Doctors often say they hate people who take lists of consultations, but actually if it's a short list of the things that really matter to you and just sort of an aide-memoire of things to remember when you're in the consultation, I actually think it's really useful. As a doctor, I never mind patients who bring short lists. If they bring long lists, often you have to say, look, these are the things that I can deal with in this consultation. These are the things I think are most important. Do you agreed about that? And then the rest of the things on the list have to be handed over to another consultation. So bringing a list along is a good thing. Making a list, making notes during the consultation isn't a bad idea either. So you've got some sort of record of what goes on during the consultation. Some rather forward-thinking doctors will actually allow you to record the consultation. They might even do it for you. This was a recommendation from the public inquiry into heart surgery deaths in Bristol. Back in 1990 they said in difficult and complex consultations patients should be given a recording, particularly when it involves explaining difficult risks about surgery, breaking bad news, management of cancer, things that often make your mind go numb and you don't actually take in much of the consultation while you're in there. Taking a recording is absolutely a fantastic thing to do, and good hospitals will allow you to do this, may even provide the service for you. But they certainly shouldn't object if you take a little tape recorder in with you to record the consultation, so you can play it back both to yourself and to your relatives at leisure later. Sounds a slightly embarrassing thing to do, but actually if you get it out at the beginning saying, look, I'm a bit worried I won't remember all of this, do you mind if I record the consultation? Your doctor really shouldn't have any objections at all. Once you've made a list while you're there, you've brought a list in, you've made a list, often worth leaving a list as well. Here are the things you've agreed to do for yourself, but here are the things you're hoping your doctor will do for you, a bit of an aide-memoire for him or her. So bring a list, make a list, leave a list. Always good technique. Also asking questions. It's perfectly fine to ask questions. If you're having surgery, how can you give your informed consent unless you know what the likely outcome is? Particularly for surgery that has major outcomes, like heart surgery, you should be able to ask, how many of these have you done? What sort of results do you get? How do you compare to the national average? How likely is it that the surgery will harm or kill me? Tough question, but it's an important question. And equally important, how likely is it that this surgery will make my life better? Recently we've started collecting things called patient-reported outcome measures. So it's not just about having surgery and recovering from the surgery and going home alive. It's also about whether you can play with the grandchildren, whether you can still do exercise and get up and down the stairs in 6 months to a year's time. So surgery actually should be all about getting you better. The same applies for any medication. If you're on long-term medication, you need to know how will you know if the medication is working, how would you know if it had side effects, what should you do if you got the side effects, when should you come back for a repeat appointment. All these questions should be asked, and you don't always sandwich them into one 6-minute consultation, so sometimes you ask them over a period of a couple of consultations. If you're getting a diagnosis, doctors make a diagnosis, we call it the hypothetico-deductive method, which sounds a bit arsey. In fact, it's basically recognising patterns and using probability. The reason doctors tell you it's probably a virus is because it probably is. Common things are common, and viruses are very common. But actually it's always worth asking a doctor when he's made his provisional diagnosis, or she, what else could it be? There's always a what else could it be, until you have definitive tests back and a definite diagnosis. And even then we're often not sure about a diagnosis, there's usually room for doubt. It's always worth asking, what else could it be? What if it's something more serious? How would I know? What should I do? A lot of these questions, to be honest, are common sense. If you thought about it in any other conversation you had in life, you'd sit down and you think, golly, these have been written by the professor of common sense at the University of the Blindingly Obvious. But when we're in front of a doctor, often our mind goes to putty. We get quite embarrassed and we worry that we're wasting his or her time. You're not. And actually increasingly, doctors who've been trained in communication skills welcome patients who participate, who ask questions. These days, increasingly, you're put in control. So whether you choose to have hormone replacement therapy is quite a tricky clinical decision. There's some evidence to suggest it might possibly increase the risk of breast cancer, but it might reduce your hot flushes. What does it do to heart disease? How will it affect your life? And these days we tend to have the conversations with you and then let you make the decision based on the evidence that we've presented to you. So we become like your own personal shopper, but the decision is yours, and doctors will now document in the notes that this particular patient has considered the evidence and decided for herself to have hormone replacement therapy. Now, some patients don't like that. Some patients would say, look, doctor, you're the expert. I want you to decide what's best for me, or I want you to choose what you would choose for your mother. And again, you're perfectly entitled to ask that. But increasingly these days, doctors will say, I can't decide for you. You have to make that choice. So whether you like it or not, doctors and patients are having a new sort of relationship. Patients are having to participate more in the decisions if they're able to do so. And ultimately the choices that are made in consultations are going to be more your choices than the doctor's. You may not feel like you get that service at the moment, but that's the way medicine is moving. So do a bit of research before you go in there. The NHS website is a good website to start with. Embarrassingproblems.com, an excellent website, because you can get over a lot of the embarrassment by realising that your problem is very common, and here are quite legitimate questions that you should ask your doctor. And you might even have suggestions for kind of treatments you want to give a go. So don't be shy, don't be embarrassed, take a list, make a list, leave a list, and ask questions like, how likely is it that you're going to kill me? Or what else could it be? Good luck, and let us know how you get on at www.embarrassingproblems.com.